Thank you for your opening address. I'm someone that has worked in a Tusla commission service, for many, many years, and many of my closest friends work for Tusla or in a commission service. And that's why I have to talk about, I suppose, Section 56 workers that, we talk about the restructuring here, and I would have been, my own job, I worked for the Sligo Leitrim Home Youth Liaison Service for 17 years, and many of us did, and we called it the Hotel California at one stage that we could never check out because we all loved our jobs so much, but the pay was so bad. We came to a stage, we didn't get a pay rise since 2008. I know through trade unions, and I'm a very big advocate for trade unions, that eventually there is a 5% and will be an 8% increase in wages, but the amount of knowledge, the amount of trust that we had built up with families locally, and the amount of knowledge that we had as professional workers, social care workers, was gone. It was left because we couldn't stay there anymore. Our wages weren't even in line with inflation. So I suppose I can see, in Mehel, I suppose, it made my job I'm a huge advocate of Mehel. It made my job much easier to coordinate services. We were often in the front, and a lot of my daily job was making child protection referrals. And I suppose, Mehel was the front face, the nice face of Tusla, and so I just wonder about the restructuring of that. And I think PPFS was a great model, and I'm wondering why that is going to change, because that was the soft side of Tusla. It was someone like me who had worked on the front line. That was an easy win. It was an easy sell, was it, Mehel? And that's what I wonder about that, and I suppose, and the CFSN, I think they're wonderful. I think SIPSI, I think those structures are fantastic, but all the time you're relying on people that are delivering the work on the ground. And I would just, if anything comes out of this conversation that we can have, could there be, when Tusla, in the commission services, can there be, in the budget that's allocated, can there be increments put into it? Can that be part of the package that people are delivering? And I know this, that as myself, I used to be chairperson of Mehel's a lot, and I was a lead practitioner, ION, that time when it was ION, but I'd be a lead practitioner holding a table where people might be on triple my salary, and I'd be the lead practitioner bringing the families in. And it's so frustrating to see that the work that the frontline services are doing, and people that would have gone into, we used to say sometimes, they'd taken the soup by working directly with Tusla, because they were on incremental scales, they were getting pensions, whereas people on the front line that I did, and many of my colleagues, many of my closest friends have done that, but they're not going to, it's not sustainable, and it's not sustainable. People won't stay in the sector. So not only are you losing the trust is being lost with families that have been dealt with, you're losing those professional knowledge that's been there for so long. And I know that people work in the area of social care. They're there because they love their job, and they're there because they care about the families. And I suppose we would promote Tusla, that's what we would have been doing, and we would have been very comfortable making child protection referrals because we have that trust built up in communities. But if there is anything we can do to actually ensure that they're basically in line with direct employees, that there is pensions, that there is going to be annual increments, even in line with inflation. And I think that, people on the ground, frontline services like the Home Youth Liaisons, like FRCs, like Springboard projects, they're holding it, and they are without them there wouldn't be the referrals. So, and I suppose that's my question. When there's an allocation of funding to individual service, and there's not a pitting against services locally for the allocation of money, of commission services, but that Section 56 workers, they need the respect that they deserve, they need the recognition that they deserve, and they need the pay. They need the monetary reward that they're in to do the job.
My colleague has an answer to that. Just though, very quickly to say, just absolutely give you reassurance, Mehel is a fundamental part of what we are doing now and will be doing even as we change our services. Family support, early intervention, as Jerry referenced earlier, we're standing up 90 teams. There'll be at least 3 family support and early intervention teams doing the work that's been done today, just under a different structure, because we need it to be more equitable across the 90 areas. CFSNs are there, there's nothing changing. We really value those work. SIPSIs are there, they're not changing. So just in terms to the reform programme, to make sure that all that is good is not changing, it's just a restructuring as we divide out our areas a little bit differently. But Pat might talk to you about what you've raised about sustainability and the payments.
Yeah, thanks for the question, and I do share the comments that you made there about how necessary and how much we depend on the work that's done by community and voluntary organisations. So Tusla spends about 200 million from our budget on community and voluntary organisations, but I suppose that's out of the 5 billion that the state spends in total around community and voluntary support. So we're, I suppose, restricted from the pay perspective in terms of anything that we can do independently of the rest of the organisation. Now, through the WRC, I know the state and the community and voluntary organisations have had discussions and negotiations across 2023 and 24. And from our perspective, we have added roughly about 16 million to the pay budget that's gone to the CNVs, and I know that that process is ongoing this year. There's more money going on there, and in the last agreement, as I understand it, there's a commitment to recognise, future awards as they go forward on that around the specific areas that were negotiated. So I think part of that's resolved. I think the other question about what can we do to support other activities within CNV organisations is something that we're also looking at, and we have some very important CNV organisations that provide residential care to us. We've recognised that they can't do that on air, and certainly since COVID, we've tried to ensure that the funding that they used to get from revenue-raising sort of voluntary support organisations, it's something we've had to increase funding to them on.
And could we get a commitment that when people are putting in their budgets or their estimated costs for, and organisations are, that they, and I mean, we all put it, like I know part of my own management team that we would have put in pay increases. But could there be a commitment? Yeah, yes, there is going to be an increment every year. That will be part of the funding. And you're holding staff. Your people is going to stay in their jobs.
Yeah.
So it's an ageing workforce as well, I suppose.
Absolutely.
We might come back to this in the second round, if that's okay.
Yeah.
Thanks for that.
I'm going to come back again about staffing, and I guess I know as well from, like I said, that many of my friends, nearly all of us work within the area of child protection or something, or social care. And I suppose you are dealing both people that are directly employed by Tusla, through social work or social care or family support workers, and also the commission services. You are dealing with a lot of trauma, and you're every day you're working with a lot of people, but families with a lot of complex needs, and I just wonder, I suppose, like we have I suppose Ireland, we have like the weakest workers' rights in Western Europe, and I think. And this is in a broad spectrum, I suppose, and I'm just looking at that. Tusla, as an agency of the state, is there a possibility that, through commission services, but also when you're contracting out services, say occupational therapy or, even residential care, any of the private services, could there be a condition that, that people, that whoever's getting these contracts, that they have to ensure that there is a protection of workers' rights, like the right to collectively bargain, that. But also, not even that though, I think therapeutic support for staff is a huge gap within definitely commission services. That a lot of managers will say in services would have they would have worked on the ground themselves, and then that there was a progression route, they became managers, but there is definitely a lack of therapeutic support for frontline staff. And I think that's an area that is definitely can be looked at, and I suppose I know that myself from working in the area, that you are I suppose working with people that are dealing with a lot of trauma, and that does rub off, there is an impact. And I'm wondering, is there any way that can be budgeted into any kind of both commission services and direct staff, that there is nearly mandatory, I think, therapeutic support for frontline workers?
I might let maybe Rosario start with that, and then Jerry, and anything he wants to add.
Thank you very much, Deputy. And of course, we absolutely value the work of our voluntary and Section 56 in particular. In relation to having mandatory diktats, I suppose, in terms of health and well-being or whatever, I don't personally favour that. I think that it's more an approach, it's a way we work. Now, as I said, what we have is our people strategy, and again, people can glaze over when you talk about a people strategy, but it is absolutely fundamentally important. We are a people-delivered service. It has to be all about the people and getting that right. We have improved, I would think, a lot in terms of providing that psychological support, those interventions. For instance, within Tusla, in terms of that pillar, it's a work pillar, trying to develop a culture of health, which is not easy and crucial. We have put in psychological supports for staff, for our frontline staff. We have our CISM approach, that is critical incident stress management. Again, a full programme of work around that. Now, I am more than happy to engage with any Section 56 provider who want to partner with us or take what we have and utilise it, rather than you paying for something like that as well. You're quite right. The work is emotionally draining. It's emotionally taxing. And just by way of information, I was looking at the top 5 reasons for referrals to our occupational health and our employee assistance programmes from our own staff. And the top 5, number 1, stress, anxiety, bereavement, depression, and relationship difficulties. So, of course, we have to get in and support the staff. I'm confident, as I said, we are doing better. Very happy to partner with you if you want to have any access to any of those resources.
That's very welcome, and I think that often, I suppose, voluntary community sector, or definitely commission services, you're struggling on a tight budget. So, even, and managers, like fantastic managers, but often they're not trained in therapeutic management and not even reflective practice, but I suppose that therapeutic, basically psychotherapy support or counselling support for a lot of staff,
Absolutely.
And so I wonder again, would well-being of staff, can that be factored in to annual budgets? Not necessarily, maybe Tusla direct staff is different, but again to the commission services, but can that be factored in, that the actual well-being of staff, it can be factored in as
it could certainly be a
as a
recommendation,
necessity, as essential.
Yeah. Senator, if I could come in just, because I know of several examples, and I think and to be fair to People in Change and the strategy under People in Change, one of the big positive changes I've seen within Tusla is that when somebody is going off sick, that there is good engagements with those individuals in terms of trying to get a return to work plan that looks at the full reasons behind the sickness absence and actually a range of supports. There's nothing that I've ever seen that has been turned down in terms of supports to a member of staff to help them return to the workplace. I can't think of anything, and anything that I've been asked for, it has been provided. And that's almost like a psychological contract, with the worker, to ensure that they get back quickly. And we all know in terms of therapy and intervention, the longer you're off sick, the less likely you are to come back. So that constant engagement from the moment of the sickness absence and indeed on return to make sure that that staff member is getting whatever individualised supports they need, but also peer support. And it's a cultural thing as well. It's about the culture of management and the culture of care for our staff that we need to constantly pay attention to and develop, and particularly in an organisation where we're struggling to get certain grades of staff, that those supports are really important.
And I do think also that I think it's important to recognise certainly what we've heard from our own staff through various different forms and initiatives. Some of the changes that are required actually are not about funding. They're about space, they're about time, they're about leadership, they're about a commitment to, as Rosario said, a healthy culture within an organisation. And certainly I know now that you've raised this with us, we'd be more than willing to do an event or a session to kind of support, community and voluntary organisations if they wished to come and kind of hear directly from us in terms of what we've found beneficial, and also, as Rosario sharing what we have, if that would be of any help. And I also do know there are lots of community and voluntary sector organisations across the country that you do see that they're putting very good supports in terms of their staffing. So it's certainly something I think that we will take away and look to see. As we obviously have, we have a commissioning advisory group, and that's the group that we have in the place in Tusla that allows us to engage, kind of once a quarter on those kind of strategic issues with commission services.
Thank you. Because I think often you're fighting a fire and that you don't have the time for it. And it's not factored in, and that could be factored in as an essential part of your work day, or work calendar, I suppose.